My name is Pam Freeland. I'm a volunteer, West Shore Hospital. Thanks to Paulo Olivero, who helped me out. I love what I do. I'm in Medical Building 1, Entrance 5. I have been here going on 2 years. I work Monday, Wednesday, Friday. I am giving back to the hospital because this is the people who saved my life. The story, how I got here, my husband passed away. He was my whole world. I became an alcoholic. Alcohol was my best friend. And then one night in December, I went to the bathroom a week before Christmas and I threw up. And from the waist up, I went numb. I knew I was in trouble, called my neighbor. He came over and I came to the emergency here. I almost died. I had tubes all over me. Dr. Moritz was my surgeon. Of course, the night this happened at the ER, I just found out that Dr. Chachati, he was the first one rushed in. I don't recall the first 2 weeks I was in ICU. I had to tear my esophagus from drinking. Spent 44 days here. The experience changed my life. I went to rehab. I spent almost 2 weeks there. The Helen Simpson rehab was just wonderful. I realized that there was a world out here. I need to get out and do something. And I said, the people at West Shore Hospital and the surgeons saved my life. I mean, I need to give back. They gave me Paulo Olivero's phone number. And I said to Paulo after a week, I can't do that. There's no people. He said, how about coming over to Medical Building 1, Entrance 5, and being the greeter? I've been here ever since, and I love the people. I mean, helping them. I mean, the elderly that come in here, I take them where they need to go. I give them wheelchairs. I get them out of their cars. It's like my second home, and I got something now to look forward to. I'm not at home. I've been alcohol-free for going on 2 years. It's, to me, everything. And, you know, I giving back for the people that saved my life. I take a bus here, and I do thank Rabbit Transit. I have an eyesight problem. I did have surgery, and Dr. Farrell up on the second floor here was my surgeon. They pick me up in the morning. I get antsy because I want to get here on, even though I don't get paid for this. I do pay Rabbit Transit $15 a day to get here. They are awesome. I would say, especially for the people out there who think their life is nothing, meaningless, whatever, volunteer, do something, because I will never regret reaching out to Paulo and doing this. I mean, there's just, even if it's not a hospital, I would say do it because it's life-changing. And there's so many people out there. I never thought in my life I'd be doing this. Volunteer, please. It's a rewarding feeling. I would especially like to thank Dr. Moritz. He's up on the third floor here. Dr. Brady, Dr. Chachati. I want to say to them three, thank you very much. I wouldn't be here without you. Best friend. And then one night in December, I went to the bathroom. What happened at the ER, I just found out that Dr. Chachati, he was the first one rushed in.
It's very cool. From the first day that I saw her when she was doing her volunteer work, I was blown away and surprised, and she came up and gave me a big hug, and it was just to see her back to normal life was amazing. That's cool. Very cool.
Yeah, when she came into the emergency department, the ED provider had called me, and I came rushing down. She was on a lot of oxygen. Her heart rate was very elevated, and she was like very, very scared and didn't know if she was going to die or not. And we tried to console her and tell her that she was in the right place and that we were going to take care of her. And it's been amazing to see her progress from having an alcohol problem to being able to give back.
That doesn't happen very often, so it's very, very appreciated. It's very, very appreciated.
Yeah. Sometimes we take care of patients and we never really hear afterwards what happens to them. So being able to know that she's doing well and that she's even wanting to give back makes us, this is what we do for.
Absolutely.
Definitely.
Yeah, that keeps you